Did you rate and review behavioral observations on Apple Podcasts? You rated and reviewed behavioral observations on Apple Podcasts, right? My friend John told me that you rated and reviewed behavioral observations on Apple Podcasts. Is that true? Did you rate and review behavioral observations on Apple Podcasts? Again, did you rate and review behavioral observations on Apple Podcasts? All right, folks, I haven't lost my mind here. I know this is not the usual introduction, but the way in which those questions were phrased will factor into the discussion we're going to have in the 19th installment of Behavioral Observations Inside JABA series. And in this one, Dr. John Borrero and I discuss a paper in the most recent issue. And that paper is called Idiosyncratic Effects of Interviewer Behavior on the Accuracy of Children's Responses. And it was written by Milad Najafichaghabouri, Dr. Ray Joslyn, and Emma Preston. Ray is currently an assistant professor of psychology at West Virginia University. His research interests include group contingencies, behavior analysis and education, and crime and delinquency. Milad is a doctoral student in the Disability Disciplines program at Utah State University, specializing in ABA. His primary research interests include group contingency-based interventions in the classroom and social validity practices and research. Emma is also a graduate student in the same program at USU, and her research and practice interests include the good behavior game, manipulating parameters of reinforcement to improve intervention outcomes, and Tier 3 school-based interventions. So I'll refrain from spoiling the entire discussion by summarizing their study here in these introductory comments, but there are a few things that I'd like to draw your attention to as you listen to the show. First, this is the first time we've discussed a replication article in the Inside JABA series, and I'd like you to stick through all the way to the end, because at the last segment of the show, John dons his editor-in-chief hat for a few minutes and discusses the importance and implications of having replications as part of the broader JABA portfolio. I think you'll find that really interesting. Another thing that's, I think, noteworthy is that describing the conditions in which children do and do not report incidents accurately has huge implications. From schools to child services to law enforcement, understanding the potential influences of phrasing questions and acknowledging responses could be crucial contributions in this area. Third, this study featured a clever assent procedure that is worth noting. In fact, assent was ascertained at multiple points throughout this study, and we talk about that in detail. And lastly, we get into all sorts of nitty-gritty details, including some of the participants' unexpected responses to the experimental procedure. And these are the things that generally don't make it into the printed page that you can only get in these types of conversations. This podcast, along with all the other Inside JABA series podcasts, along with many other podcasts in the Behavioral Observations catalog, is eligible for continuing education. If you've never gotten CEUs from Behavioral Observations before, it's really, really easy to do. All you have to do is listen to an episode, then go to behavioralobservations.com/get CEUs, make a purchase, and then you can just take a quick quiz to verify your attendance, and then you're good to go. And just as a quick aside, there are discounts available for bulk purchases. So if you need a bunch of CEUs, and no judgment here, of course, we have you covered. So to learn more, go over to behavioralobservations.com/get CEUs. So I think that's it for opening remarks. So without any further delay, let's kick off this 19th installment in the Inside JABA series.
Welcome to the Behavioral Observations Podcast, stimulating talk for today's behavior analysts. Now here's your host, Matt Sikoria.
All right, we're here for the Inside JABA series number 19. These are getting up there, and these are always fun to do. I'm joined today, as always, by Editor-in-Chief Dr. John Borrero, and we have some very special guests, Emma Preston, Milad Najafichaghabouri, and Ray Joslyn. We're talking about a really neat paper. I guess there's a lot of fun things about doing this Inside JABA series podcast. One of the things that's really fun is when John sends me the table of contents for the upcoming issue, and he and I get to dialogue a little bit over what would make for a good show. This particular issue of JABA was an embarrassment of riches because we had quite a number of offerings that we could have talked about, and so we landed on this one just because it was a really unique paper. It's called Idiosyncratic Effects of Interviewer Behavior on the Accuracy of Children's Responses. So, and this is a replication as well, and I think this is the first time we've talked about a replication, if I'm not mistaken. So, if any listeners can recall another time doing that, please let me know if one of those has slipped my mind. But I think this is the first replication. Anyway, as always, whenever we talk about these studies, I'm always curious, like, what got people into this line of research in the first place. So, the interviewer behavior, usually in JABA, we're concerned about things like, mans and tax and reducing things like self-injury and physical aggression. And of course, there's other things that have, broadened those topics certainly over the years. But this is nonetheless, at least from my perspective, a pretty novel subject, if you will. So what got you interested in pursuing this?
I'll kick this one off just to kind of set the stage, and then Milad and Emma, you guys can jump in. But I've always kind of been interested in crime and delinquency, dating back to when I was an undergraduate. And I think when I was in graduate school, I did my area paper, which was format of the qualifying exam at the University of Florida. I wrote an area paper on crime and delinquency. So I ended up reading, I don't know, many articles about crime and delinquency, and not very many of them were behavior analytic, but there were a few that really kind of stuck out to me. And one of them was the Sparling et al. 2011 paper that we replicated in this study. It was a brief report, and they had some really interesting, compelling data in there that showed not only that, children, the accuracy and inaccuracy of the answers that they give to questions, not only are those sensitive to different things an interviewer might do when asking the questions, but they're idiosyncratic. So some of the kids are sensitive to certain types of questions. Other kids are completely different, and they're really responsive to maybe repeating a question, whereas a different kid might be really sensitive to providing a leading or a suggestive question or something like that. And so when I was finishing up in grad school, I tried to get something like this going, and we were going to try to replicate it with kids diagnosed with autism. And we were able to pilot it a couple of times, but the methods needed a bit more modification to get it to really work. We were having trouble getting them to watch the videos sometimes, or, getting them to participate in the interview process in a way that we could be confident in the data that we were collecting. And so that kind of got put on the back burner until a couple of years ago when I was at Utah State working with Milad and Emma. This has always been kind of creeping in the back of my mind, like replicate Sparling and all 2011. And so when we were all together at Utah State, I kind of pitched the idea to Milad because we had a really cool lab space at Utah State, and he was really interested in it and kind of jumped on it.
I see. And I do want to kind of dive into the work that's been done in the, I guess, what we might call the single case realm, if you will. But if we can just back up a second, and in your paper, you cited a number of other studies that were, we might consider non-behavior analytic in nature, perhaps, or, and were conducted in more of a traditional kind of groups design. What were we able to make from those studies in terms of the, in other words, were there any consensus? Was there a consensus from the existing body of literature about how this stuff worked?
Yeah, I think the consensus is that children are affected by interviewer behavior, broadly speaking, but it's really, and I'm still in the process of kind of going through this. It's a really massive literature base, and one of the tricky things about becoming really familiar with it is that everybody in every field is doing this in some way or another. So developmental psychology, clinical psychology, cognitive psychology, criminology. There was a journal that referred to criminological psychology. And so there are all these different people are really interested in this topic, and they have different theories as to why this happens. They take different approaches to answering the questions. And so, it's been pretty well documented that children will respond to different types of questions that may be suggestive of a particular answer. You provide co-witness information and say, well, my friend said this is what happened. Is that what happened? And those types of things. But the way that they do the studies differs in a lot of small and large ways. And so they're getting different they're getting different results when they run these studies. And so sometimes the children will be really sensitive to a particular arrangement. And then in another study, they're not quite as sensitive to that, but more sensitive to another arrangement. And so the general guidelines for doing these types of interviews with children are just to kind of avoid, in general, doing anything that may influence them to provide a different answer than the one that they would without outside influence.
All right. I know John wants to get in here, but I'll just observe momentarily that that last piece of guidance is, I would imagine, open to interpretation of what that actually means. So anyway, go ahead, John.
Yeah, I really like the way that you set that up. And I want to kind of underscore one of the things that I think is very important about that observation. You said many, many people are interested in this particular challenge. And to me, that is evidence that you're studying something that's going to be of interest to folks outside of the typical JABA readership. And one of the things that we often consider, particularly in my role as editor, is trying to get new readers into the journal. So with a subject like this that crosses so many different domains of professional psychology and other areas in general, I think we get more people to the journal who are going to be interested in your work, and then they'll incorporate that into their meta-analyses and so on. So it's a really neat opportunity to bring others into the JABA readership.
Yeah, I'm glad you brought up the meta-analysis. Are there existing like systematic reviews or meta-analyses on these? And if so, are the conclusions, as you stated, just, obviously kids are susceptible to these kind of the way in which questions are structured and how people respond to them?
Yeah. So that's kind of the general consensus. And I think what I've often found, at least and I want to give a disclaimer on this again, like I am not completely familiar with all of the different aspects of this literature base quite yet. I've been doing a lot of reading on the topic, and I'll talk kind of about where we're at with it right now later on. But a lot of times you'll find meta-analyses or literature reviews where they're kind of looking at the work that's been done in this field. Like, how sometimes a behavior analytic paper may focus on behavior analytic studies and stuff like that. And so that's kind of what I've found when I'm looking at it.
And I think the other behavior analytic paper was the paper by Carla Depke and colleagues as well. And you went into that in some level of detail in the paper. So in terms of what we know from the ABA world, in addition to the Sparling, what was noteworthy about Carla's paper?
I can touch on that one a bit too. There's this kind of interesting study because their method was single case, but some of the way that the procedures took place was a little bit in between, similar to how the group design. It was quite a bit different than how our paper and the Sparling did it, in that like they're watching something and they're being immediately interviewed. In their paper, they had children go to these like made up visits, health checks, and afterwards they'd give them a little bit of free time and ask questions, and kind of generally very broadly, and I can go into more detail about the study if we want. What they found was that anytime there was any kind of suggestive information added into the interviews, that tended to decrease the accuracy of responding for the children. And also what they did was that they had these three different conditions. One where the parent that was with the children during the interview didn't really say anything about the interviewer prior to it. And they had one condition where parents would say positive things about the health check. So it would be like, the person was really nice. I liked them. You enjoyed that, didn't you? And then there was a condition where the parents would say negative stuff about it. So it would be like, oh, like, I hope you're okay. That like, he wasn't very nice and so on like that. And what they found was any of the introduction and again of how a parent kind of providing any sort of input about how that experience went tended to again decrease the accuracy of responding, and in particular when it was a negative. So the the health check itself was done in a pretty pleasant experience for the child. So when the parents introduced the negative component, which didn't really happen, they were added in, that had tended to have a greater effect on the accuracy of responding. And across all the questions, as time went on, the accuracy also decreased. So with the passage of time, the further it was from the actual health checkup that happened, the accuracy tended to decrease as well.
And by the end of those conditions, they were at like chance levels of answering the questions, multiple interviews post health check.
And I suppose, I kind of inferred this from the article, and this is perhaps an opportunity maybe to correct any potential misunderstanding. But I'm imagining that the broad goal of examining this topic, regardless of methodology or whatever, has implications for things like, interviewing children if they've, witnessed, crimes, or, I can imagine on a perhaps a less severe level, this would be interesting for, say, like an assistant principal in middle school or something like that. There's, maybe and anyone in that world spends probably an unfortunate amount of time going through, bullying and harassment investigations. And, that involves talking to a lot of people and trying to figure out how to, so I'm assuming that that's the goal of this sort of thing is, how do we provide best practice in terms of talking with kids in order to gain accurate information, and how not to let our own, whatever we're bringing to the table, unduly influence them, resulting in information that's inaccurate. Have I summed that up? Are there other aspects of this that are also, in terms of applied, the applied nature of this that I'm overlooking here?
I think you summed it up really nicely, because sometimes, especially with like some of that, it's frames that we think about those more like bigger issues that, like, if they're in a court proceeding where more high stakes situations, that we focus on those because the outcomes are a little bit more severe in those situations. But there's a lot of like day to day and less impactful in a way things that happen that a lot of us in different roles that may be doing these things that may, like, without any intention, changing their responding. So I think it's a much broader application than just those like really high stakes that, like, children's witnessed the crime or something, or they've been in a domestic violence situation and now they're being interviewed about that. I think it has more broader application to, like, the example you gave with this in a school setting, like a kid is being bullied or has witnessed some bullying, things like that.
All right. So we've got the Sparling study that you talked about earlier. What what were the, what did you want to accomplish in replicating the Sparling study?
So there was a couple of things. For one thing, like, the children in Sparling were quite sensitive for the most part to a lot of the conditions that they came across, which is pretty interesting because they're watching this video, and in this case, they're immediately being asked about something, and there is quite a bit of sensitivity to the various conditions they went through. So for one, given that that study included 3 children, one of the things was, well, what if we do it with the population elsewhere? And after, different kind of time period too, since Sparling took place about 13 years ago now. That was one of the things. The other thing that Sparling didn't have was that our third phase of the study, which was combining those two. And I think that helps us move a little bit more closer to naturally how this might happen. Whereas, like, if a child's being interviewed about something, it's likely that these things are getting kind of mixed in together. So I think that was one of our goals too, of, like, in isolation, do we get similar results or do we see different results? And also when we start to combine these things, because I think we see a lot, like you would see more of that in practice. How does that then impact? Are we going to catch somebody that might not show sensitivity in isolation to just how you frame the question or how you respond to it? But then when you mix those, do we start to see more sensitivity?
Okay. All right. So we're talking about things. We're starting to get into the weeds of the study here about the different conditions, and I want to get more detail because I think the five of us here, or well, the three of you actually are very intimately involved in this, and perhaps John and I less so, but we've all read the study, and so I'm trying to put myself in the shoes of the listener who, and so what I want to do is perhaps painstakingly go through the different conditions, the different types of questions, the different type of outcomes in just a minute. Before that, though, definitely caught my eye. There was an assent procedure that you described, and I thought it was pretty clever. And it's not a topic that we've discussed that much on the podcast, and I think it would be noteworthy to highlight here. So we'll get into the weeds of the procedures and the independent, dependent variables in a second, but just talk about the assent piece briefly, please.
Sure. So when we had parents come in, so I'll kind of walk through the entire consent and assent process, if that's okay.
Sure.
So parents came in, we kind of briefed parents on what we were going to be doing without the children present. And then after that, we put during our consent meeting, children, we gave them a question. So we asked them, I think it was 10 questions, just brought about do you have any pets? How was your day? What did you do today? Asked them that, confirmed questions, and then we showed them a video, basically like a little mini example of what they would be exposed to. And during those meetings, the parents were also in the observation room with us, so they got to observe, and beyond our description of what we were going to be doing, they got to experience a little bit what it looked like that we would be doing with their children during this process. And then if they met our inclusion criteria and kind of got accepted into the study, we also debriefed, provided some brief explanation to children of what they would be doing in terms of just you're going to be watching a video and we're going to be asking you some questions and not really going into details of different conditions or anything. And at the start of each session, what we kind of did was had them sit down, and then always at the start of each session asked, okay, so we're going to be watching some videos and answering some questions. Is that something that you're willing to participate in today? And if they gave some kind of affirmative response, like a yes, yeah, a thumbs up, nod, then we proceeded. And also during the time too, if we ever notice a child is starting to look a little bit more squirmy, or it might look like they might be done, we just presented that question again to all right, just want to make sure that you're still good to continue. Maybe we have half an hour left in our allotted time. Are you still okay to continue? And again, only proceeded if we got that affirmative response. In all of the sessions, we never had anybody that wanted to not pursue with the session or end the session early.
Okay, that's interesting.
And just to add on to that, I think a lot of the times when we saw squirminess or one of the participants kind of looking like they might be less into it, it seemed like it was more of Scooby-Doo fatigue than anything, because there were a lot of videos. They watched a lot of videos of Scooby-Doo.
And we gave them they would watch a video. I'd go in immediately after, interview them. They'd have a couple-minute break, so the opportunity to either just hang out or go get a drink or something, and then kind of watch again. But in a session, they would watch 10 to 12 3-5 minute videos and get asked. So there was a lot of it. Yeah, they were, for the most part, they were all very big Scooby-Doo fan, but there was definitely sometimes as they get towards the end, there would be a little bit more of all right, there's been a lot of Scooby-Doo watching.
I see. Scooby-Doo was in heavy rotation in my household when my kids were young. So I think I would imagine they would have assented quite enthusiastically. So, but that was a little while ago. I'm sure there's probably more entertaining things out there right now. But anyway, so all right.
So there's another feature about that, though, just for clarity. Is it the case that they signed a document that said that the children, did they sign off?
Yes. So if any of our participants were over the age of 7, they actually had to consent to that process as well. So that took place during our initial consent meeting with parents and the children, and that was when they did the screening. So before we started that initial screening of having them answer the question and stuff, we went through, explained what would be happening, and then they had to sign off. So that happened only with participants that were over the age of 7, though. So I think one of our participants who was 6 years old, she didn't go through that process because the IRB here isn't a thing. But if you're over the age of 7, then we went through that where they formally had to also sign that consent document.
Yeah, that's not something that I often see. So I thought that was a notable feature of the strides that you took to provide an informed assent and consent process for all parties involved. I thought that was rather neat.
Yeah, it makes me wonder what the distinction was between 6 and 7, but that's probably an IRB question. So
I think it's just a kind of rule of thumb on, at what age or are they able to provide consent versus assent. And when we were kind of going back and forth with the IRB on it, that's the age that they liked. So
I see.
Well, and to be clear, the parents had to consent because they were minors in general. So you had multiple levels of evaluation there, and I think that's important.
Yeah, for all of them, parents had to consent, and for those ended up being over the age of 7, that was just that additional. So if a child, for whatever reason, didn't want to consent, then that was a no-go.
Mm-hmm.
All right. Thank you for reviewing that again. I thought that was a really novel way of ascertaining their willingness to participate. So, all right, let's get into the study itself. I'm sorry for all that long wind up here, but I think it's important to lay the foundation so the audience kind of knows the context in which you did this work. So, having said that, what was the general, we mentioned the videos and things like that. So let's place this in the context for the listener who is completely novel to this whole enterprise. What was the general task that you wanted them to do? And then let's walk through. Yeah, let's just start with that, and then obviously what happens after in terms of the different types of questions, different types of responses, et cetera.
Yeah, I can give a brief overview of what happened. Essentially, we had these kids come into our clinic rooms, which are, one-way mirrors. So the kids would be in the room where we could look in from the one-way mirror. They would sit down with Milad, who had already meticulously scoured YouTube for all these video clips and created a bunch of pretty straightforward questions that were related specifically to each clip that he had pulled. The kids would then sit down with Milad. He would have them watch a video, make sure that they were oriented to the screen, sitting in a spot where they could see it. They would spend a few minutes watching the video with Milad in the room. He would then move the computer over and ask them a series of questions, all providing some kind of either yes or no response. And then they would take a little break, like Milad was saying, between each video, and then jump back in, do the same thing with another video.
Okay, great. And so let's walk through the different types of questions. We kind of highlighted a couple of them earlier, but let's go into a little bit more detail of the different types of questions that you asked.
Sure. So we had 3 phases of the study. So I'll kind of walk you through each one and what each one entailed. So in phase 1, we had our antecedent manipulations, and this is just how you phrase the question, basically. So like, how are you asking the question? And in that, we had 4 different conditions. So we had a control condition, which would just be like, was Scooby wearing a hat? And all the questions were yes or no. And with our control conditions, the response could have been a yes or no. Like the correct response could have been either one. And then we also had suggestive questions. So this would be adding in a piece of information about something. And in this, for a suggestive question, it always added in something that had not been observed in the video. So if Scooby hadn't been wearing a hat in the video, I might add, Scooby was wearing a hat, wasn't he? So for this condition, the correct answer was always no. We had a co-witness, which is very similar. Again, you're adding in something about that didn't happen, but this time you're suggesting somebody else saw it. So I might say, my friend said Scooby was wearing a hat, wasn't he? Or is that true? Something along those lines. So suggesting that somebody saw reporting an information that didn't actually happen. So the co-witness also, the correct response always would have been no. And then we had a re-questioning, which was formatted the same way as the control. So it asked just a general of like, was he wearing a hat? And the answer could have been a yes or no. And the difference here was that after the response, we verbatim just repeated the question again. And what we recorded data on was, what was that initial response? And did they change it? And if they changed, in what direction? For this, in phase 1 of this study, all of them were followed by a neutral response. And a neutral response was just saying, okay, no vocal inflection, no kind of nothing, just okay, and moving on. So that was phase 1. And they got exposed to each of these 5 times. So each of these videos were paired with, each of these conditions were paired with different videos, and they got to experience each one of them 5 times. So 5 control videos, 5 suggestive videos, co-witness, and so on. So that's phase 1. In phase 2, it was the consequence manipulation. So this is where how the interviewer responds to children after they respond to the question. The format of the question was similar to the control one in that it asked general questions about events that may or may not have taken place in the video. So the correct answer could have been a yes or a no. And in this one, during the control condition, the responses were always followed by a neutral response. So just saying, okay, and no vocal inflection. We had 3 other conditions. One was that we called it like the reinforcement condition. So we didn't do any kind of reinforcer assessment to see if it actually functioned as that way. So when we asked the question, if the child responded correctly, then we would give them a neutral response. If the response they provided was incorrect, was the reinforcing consequence. So in this case, it was an approving statement saying good and smiling at them. In the punishment condition, if the response was correct, we gave them a disapproving statement. So this often looked like me saying, that's not right, and frowning. And then if the response was incorrect, then we just gave a neutral response. And in one, the reinforcement and punishment, it was basically those 2 combined. So if they responded correctly, it was followed by that disapproving statement. And if they responded incorrectly, it was followed by the approving statement. I had to think about it for a second there too.
Yeah, a lot
so
of
that's
pairs,
phase
yeah.
2. Yeah. So these 2 phases were in an alternating treatment. And again, in this one, they watched 5 video for each of those conditions. And in phase 3, this was kind of like the extension to Sparling et al. And the work that they had done is we started to combine these. So we again had a control or baseline where it was same as phase 2. We asked the question, followed by a neutral response. And then we had a few different conditions here. We had one that we called the highest condition. So we combined whatever condition based on their average incorrect responding from phase 1. So let's say a participant had re-questioning as their highest inaccurate in phase 1, and followed by like punishment. That was the one for phase 2. Then we presented the question in the re-questioning, and then the consequence was punishment, the disapproving statement for incorrect responses, and then neutral response for a incorrect response. We had one which was the lowest, which is basically it did the same thing, but we did that for the conditions that produced the lowest inaccurate responses. That condition we only exposed Emily to that because of the lack of like differentiation that we saw between for our other participants. So Emily was the only one in our study that went through that one condition, because everything else we're getting to like 0.3 difference percent like mean responding, and it really didn't make sense to combine them that much. So what we had was a combination question, and this was designed to kind of catch the ones that may not be responding to the previous ones. And this combined everything into one like super question. So the questions would be either start off in a suggestive or co-witness. I might say, my friend said Scooby was eating an ice cream. Is that right? If they responded correctly, I would provide the punishment contingency. Or no, if they responded correctly, I would then present the same question, so the re-questioning basically, but this time formatting it in the suggestive, saying, he was eating an ice cream, wasn't he? And then if they again responded correctly, then they would come in contact with the disapproving statement. And that was 4 of the participants that went through that because of that kind of lack of differentiation that we saw in their responding to previous phases. And that just basically, so it alternated between whether it started with like a request, whether it started with suggestive and switched to a request to from suggestive to co-witness, or started with co-witness and went to suggestive.
Okay.
And if and I might add too, so if I presented it and they provided the incorrect response, then we praised them and didn't present the question again.
So there's a lot going on here. And I think one of the things I would recommend that the audience do is go to behavioralobservations.com and look at the show notes for this episode. Because what I'm going to do, I'll take a screenshot of the main graph from the study and put that right in the show notes, because this is a situation again where the picture could say 1,000 words. Ray, I saw your hand up.
Oh, I was Milad got to what I was going to say. I don't want to derail us too much, but there was some. So in the antecedent manipulation in phase 1, the re-questioning component was kind of debated as whether it was an antecedent or a consequence. And we ended up going with describing it as an antecedent for 2 reasons. One is that is how it's commonly described in the existing literature, so for consistency with that. And then second, the question was represented non-contingently. Correct me if I'm wrong, Milad, but if they gave the correct question, they got asked again, and if they gave the incorrect question, they got asked again. So it wasn't, there was a question following the response, but it wasn't contingent on whether or not the question was correct or the answer was correct or incorrect.
That sounds like a very strong rationale for that. And if we can just step back for a moment and sort of be regular old people here, that sort of approach makes you question things, right? It's like, so if you're a behaving organism and somebody asks you a question and you answer and they ask the question again, just loosely speaking, it kind of makes you doubt what you just said. So from an antecedent manipulation, it sort of makes sense to me that this might influence the correspondence that people have based on observed events and what they say about those observed events. And there's a pretty large literature that suggests that the way that questions are framed can influence the types of responses that people engage in. So again, there's a very rich literature that your procedures have been informed by, that you've kind of distilled into this really tight, well-controlled replication study. And I just want to make sure everybody understands that there's a lot of work that went into this prior to your conducting this study, and it makes a lot of good intuitive sense to me.
That's a good point, John. And as I was reading this, and even more so as I'm listening to you guys talk about the nuts and bolts of the implementation of this, in my mind, going through every police procedural show that I've ever seen. One of my kids got on a Law and Order kick, and of which there's like 20 gazillion seasons of. So in the background in the house, I've heard a lot of those. Tell me again where you were, on April 17th. So, and I, again, in case any of the listeners, this might be helpful. Again, the idea is to see how the kids responding can be influenced, and I suppose influenced negatively, or at least untruthfully. In other words, this is not a truth-seeking exercise. This is an exercise to look at the susceptibility to influence. Is that fair to say?
I would say that's fair to say partially. So it's interesting, and if you go into the literature, there are kind of 2 ways that people talk about why this might happen. And so one of them is compliance, where it's clear, speaking loosely, it's clear to the person being interviewed what the interviewer wants them to say. So if you're saying Scooby ate an ice cream cone, right? And you like raise your eyebrows or you do something like that, that indicates the correct answer isn't the correct answer, so to speak, speaking loosely. And then there is the suggestibility aspect of it, which is like, it all relates back to stimulus control, but kind of like what John was saying earlier, if I'm asking you a question in a certain way, or I'm acting like confused by your answer, that may, cause you to say, wait a minute, maybe I got that wrong. I'll try saying yes, or something like that. And so those are kind of the two mechanisms, if you will, by which people talk about why this might happen.
Another feature of this in response to Matt's observation is if you understand the conditions under which inaccurate reporting is highly probable, then you understand the conditions under which accurate reporting can be made more probable. Mm-hmm. And so at the back end of this, when you've got kids who are, for example, reporting inaccurately, there are some suggestions for how to go about reinforcing say-do correspondence, or the correspondence between events observed and that which we report on them. So I think, do I have that right, Ray? There are two components to it. When we know what makes inaccurate responding, it leads us to identify the factors that contribute to accurate responding.
Yeah, and that's definitely a big picture goal of this line of research. We'll probably talk about this a little bit later, but we're really interested in getting to a point where we could not only say, like, in a general sense, kids are sensitive to these things. We're really interested in going in a direction that says, well, this particular kid is likely to be sensitive to these things, or this particular kid is more likely to give accurate responses if you do this and don't do this, or something like that. And maybe there's some type of an assessment or some type of, intervention or process that you can work with kids to improve that or something.
That is an excellent segue, because that leads right into what I was going to ask next in terms of the anecdotes and some of the individual differences amongst the participants that were observed. So on, I think it's page 470, he quoted one of the participants, after being asked, these leading questions, or, being, perhaps experiencing the some other aspects of the procedure, saying, why do you keep saying that? In other words, this kid seemed to appear, seemed to realize what was going on here, I suppose. And then you had Emily, that Milad, you mentioned. Emily was very, very sensitive to the reactions from the, from the her responses. So and again, go to the show notes for this episode. It'll jump, Emily's data will jump right out at you, particularly in comparison to the other participants. So what we're talking about here will make a lot more sense if you look at the graph. So to that end, were there other anecdotes or observations like that just, that space just didn't allow for? I'm just curious what the, kind of these kind of like unscripted reactions, if any more of them occurred.
Yeah, I think we got some like really interesting like responses from them to kind of like the interview. One, like that one was from one participant. We had one participant that was almost running his own experiment, that every time I told them that, no, that's not right, he would tell me, yes, it is. And he was just as consistent with them as I was. That was like example again of, we had sometimes I would get a lot of odd looks of like, were we just not watching the same video? Like, why are you asking these things? So I think a lot of those, and like a lot of kind of interesting responses from them. And what it speaks to is that like individual difference that you see, and how there's not one broad rule of like, this will work for everybody. I think like kind of Ray talked about, there is like, what really we think single case design works really good with this is that allows us to kind of identify some of those individual differences, because for the participant that kept telling me, no, it's not, he didn't find that consequence to be punishing at all. If anything, it reinforced his behavior of making sure that he tells me that I'm wrong. Whereas with Emily, once she kind of experienced that condition after 2 sessions, it was very clear that this was pretty aversive to her. And she would engage in the response to avoid it. And in between sessions, like in between kind of videos, I'd leave the room and give them a couple minutes, and they'd be in there, and we'd sometimes kind of hear her talk. Like she knew that she was providing the inaccurate response. Like it wasn't that she now all of a sudden thought, okay, these answers, like these were the correct answers. She knew, but it was just like to avoid that consequence that was coming, which I think is important. That again, being mindful of like how we respond and how we respond to their like the way that they respond to question, because it can have a pretty big impact on how they change their responses going forward. And I kind of get it. Yeah, go ahead.
No, I'm sorry to have interrupted it. I think that this is so cool because it permits behavior analysts to incorporate and rely on measures and metrics used outside of behavior analysis that all converge on the same behavioral phenomenon. So, for example, measures of sociability or measures of influenceability, I'm not sure if that's a word, the extent to which one can have their verbal behavior influenced, those sort of metrics going into it may not be informed by behavior analysis, but they may allow us to better understand the impact of our independent variable on these on particular individuals or particular subjects. So again, the opportunity for bringing in work outside of behavior analysis seems very, very high and very, very ripe.
Yeah, I was thinking like the personality psychologist would, have a field day with this, in terms of looking at things in terms of agreeability versus disagreeability and some of those other, kind of big five variables, and it'd be interesting to see if those would correlate with some of these differentiated responses that you're seeing from the participants. Milad, I cut you off. I'm sorry. Please go ahead.
No, I think that I would just kind of like what he touched on, what John touched on, that there is a lot of like, I think, additional information about the learning history and how this individual is and their personality that like we didn't necessarily collect enough information here to kind of make a judgment on or anything. But there is a lot of stuff in the background that goes on that can have a pretty big impact in terms of like how they're going to respond.
And I just to jump in there too, and I think the anecdote that Milad was just telling and some other little pieces here and there, they let us use, behavioral frameworks to look more closely into these mechanisms. So why is this happening? Is it a suggestibility thing, or is it, are they being compliant? Is it a compliance thing or something like that? And so if you leave the session and the participants in there and like says, oh, why do they keep saying that? Or like, why is he asking me to say that? That's so weird. Or this is a really specific thing, but actually in the Sparling 2011 paper, their participant, Abby, if you go and look at that paper, in the second baseline phase, you get this inaccurate responding that persists across 5 sessions at almost 100% inaccurate responding in baseline. And so that's evidence that it is a compliance thing. For me, at least it is, because there is no antecedent or consequence manipulation happening, but it might be a carryover from the re-questioning phase. And so we can use that to inform, like, why might this be happening? And kind of use that to design future studies to get more at the why, not just the what of the problem.
I looked at that study also, Ray, and those data are really compelling. It's whatever you do immediately before that evaluation, so that can prime an individual to engage in more accurate or inaccurate responding. So it's getting at that point of how you would approach this in matters that are quite more grave than those evaluated in this study. Mm-hmm. But you'd get a sense of how to prepare the person before going into that line of questioning. I like that idea very much.
Yeah. And I've been just doing a dive into all this stuff and looking at the different interview techniques and things that people have recommended at various points in time. And at one point in time, there was this really big case that was about like child abuse in a preschool in California in the 80s. I can't remember the exact name of it off the top of my head, but when they suspected that there was some abuse happening in this school. And so the school sent out a letter that said, we recommend that all parents ask their children about like whether or not this happened or something like that. And it kind of made me think like this is a really common thing that probably happens even before there's a forensic interview or anything. Like a parent or a teacher is going to ask the kid about what happened. And if they're asking questions in a particular way, that may, you know, affect the answers that they're going to give to interviews later on, even if the subsequent interviews aren't presented in a biased way or something like that. And so there's a lot of there's so many different ways that this could play out in a real world context.
I'm wondering, the anecdotes that you shared with Emily and Alex and some of the kids in the study were really notable. And I wanted to know whether there was a debriefing that occurred after where the children learned what happened in terms of your experimental manipulations, and if you can speak a little bit about how that unfolded.
Yeah, so we did that with all the participants after kind of their last session was done, and took them back with their parents and, explained a little bit. All right, so like you might have wondered like why I was acting weird or like asking you all these questions, and maybe like when you're answering the question correctly, I'm telling you, no, that's not the case. Explain that like what was the purpose and why we kind of did the study and how that would help us better understand and prepare for like better like situations in future, and gave them the opportunity to ask any questions they had. Like I think given they were all pretty young participants, all of them like nodded along and yeah, got it, but didn't really get any questions of like anybody asking me any follow-ups.
They were
So
just like, get me
nobody
away
said,
from this
I
guy.
knew it. I knew you were messing with me. I knew it all along.
I think it was like probably gratifying for some of them to know like yeah, they're like either like he wasn't going crazy or like I wasn't going crazy, like there was something happening here.
One thing that occurred to me as we were chatting here, when you guys were looking into this work, whether it's in the literature review itself, preparing for the study, or implementing it, I can imagine that some of this might have some implication, implications in terms of work that's closer to what the average BCBA does in terms of caregiver interviews and things like that. Did that cross your mind at all when you were at any phase of this work that you're doing in terms of how we interview parents and staff and other types of stakeholders?
I mean, I'll just jump in. I think, when I originally became interested in it, part of the reason that it was so interesting is because, yes, these studies are put together in a kind of a analog forensic interview context, but the phenomenon that we're studying happens all the time, all around. It's not just with children. Adults prime each other or influence each other's responses all the time. It's just it's a totally pervasive phenomenon, and I think it's definitely relevant for those cases where a BCBA may be more likely to encounter. And I think it's also worth mentioning too that, if you are a BCBA and you're working with young kids who have autism or intellectual disabilities, I believe that it is the case that children with autism and intellectual disabilities are at a higher risk of being victims of abuse and neglect and things like that. And in addition to that, there isn't as much information available about like population specific information about, interviewer behavior and the antecedents and consequences of interviews and things like that. And so I think, we don't have a ton of, at least a ton of single case individual differences information to inform how a BCBA might ask questions to a kid who may have autism or an intellectual disability, but it's got to be relevant. At least for some kids, there's got to be some sensitivity there.
When we talk about like how important it is to think about when we talk to our students and our clients about these really maybe dangerous situations, we've talked as a group about one question answered incorrectly could result in a call to CPS or, an entire investigation, or one question answered incorrectly could result in that not happening. And so while we think like, oh, these kids answered some questions incorrectly, some questions correctly, did we see something that's really important? You think one question can make the difference when we're talking to our clients. So I think it's just really important to think about those impacts.
We got a couple more. You guys have been very generous with your time. I appreciate it. I just got a couple more questions for you before I let you go. Ray, you started to talk a little bit about what you want to do next, or is there more? If there's more to say on that, I'd like to give you the opportunity. Then I've got an editorial question for John that we'll close out with.
Sure. Just let me know if I start talking too much, because this is I've been on this for like quite heavily for the past couple of months.
Let it fly. Let's go.
Yeah. So I'm actually just finishing up my first year as a faculty member at West Virginia University, and so I've been kind of establishing a new lab. And historically, I've been school-based researcher. I do a lot of work with group contingencies, but I've been kind of bitten by this bug with this interviewer behavior stuff. And so with some of the students out here at WVU, Amina Bukris and Maricela Aguilar, we've been just pouring through the methods really that we're implementing here to do this. And there's so much detail and minutia that you could really get into. One of the things that we're doing is we're looking at doing some descriptive analysis of the types of questions that we're asking. And so we've kind of categorized so you can ask a question about like a discrete event. Did he eat a sandwich? You can ask a question about a background event, like what was the weather like? What color was this thing? You can ask whether a person was present or absent. You can ask all these different types of questions. There's the difficulty at the question. And so we kind of speculated in the current paper, that a harder question may be more likely to be in the response to a harder question, may be more susceptible to influence. So if I ask you if I say the sky is green, right? That's going to be really hard for you to, answer incorrectly. But if I say, Scooby had 7 spots, right? And maybe he had 6 and you didn't count them all, you might be like, yeah, sure, he had 7. That makes sense. And so we're looking into that sort of stuff. And the student I mentioned earlier, Amina, is really interested in rapport in the context of, providing behavior analysis services in schools or clinics. And so that's actually a big topic in the literature already, which is the rapport that an interviewer might have could kind of enhance effects of these potentially influential behaviors that they're engaging in. And so we're trying to figure out how to do these, set up some strong methods to evaluate these things. And so currently we're kind of working through getting a really solid method that we can apply across all of these different things, where we've got a consistent number of the same types of questions being asked in each interview. And we're trying to make it even, because for this study and a Sparling study, I'm pretty sure it's just like we watched a video and we came up with some questions and then we asked them, but there may be a little more to that to get more consistency. And then there's 2 other things. One of them is that we've started kind of piloting some of this stuff out here. And one of the things that we started to do was we noticed that when you're doing these leading questions, the suggestive questions, and Milad mentioned this earlier, all of the answers are no. So if a participant picks up on that, and maybe some of the questions are really obvious, and so it's like, oh, the answers are all no, and it's quite obvious. And so one of the things that we're kind of playing around with right now is mixing in some conspicuously correct suggestive questions. So, if one of the first 3 questions is, this is what happened, right? And it's very obvious that definitely happened, and they're leading you to the correct answer. Does that enhance suggestibility to subsequent questions that are incorrect? And then looking into, like I was talking about earlier, replicating this with some different populations. We're particularly interested in doing this with kids who have autism spectrum disorders, and because that's an area that there's not nearly as much research as I would have expected to see when I started to look around.
Awesome. Lots of exciting stuff. So I know I will be tuning into that for sure.
And I encourage any listeners to get in on this too, because there's so many questions to be answered. There's a lot to do. So
fantastic. John, I have a editor-in-chief question for you. And so this is a replication. And again, as I said at the outset, I think this is the first replication we've discussed. Can you talk about the role of replications in Java and, what, if people were considering doing one, if people are considering submitting it, or, which, I'll leave it to you to address it's kind of a big topic, but I know you have some thoughts on it. So I'll let you close us out with that.
Yeah, thank you for that. So there's some background information. In 2023, JABA publishes 4 issues a year, and we get a little over 300 submissions. And the majority of those submissions are designated as research articles, and that's typically involving original research. But about 13% of our submissions in 2023 focused on the category of replication. And in 2022, it's about 11%. So there's just a minor little uptick there. So replications make up a small but a very consistent part of our Java portfolio. And I really like that you kind of started with the observation that we haven't done, at least to my knowledge and yours, a replication as a focus of the Inside Java podcast. But a good deal of applied behavior analytic research involves single case experimental designs. And we use repeated measures under various conditions, and we use a fairly small number of participants in the research that we conduct in our practice. So the challenge there is that when you're talking about applied behavior analysis to the lay community or perhaps individuals who aren't trained, and you say, well, there are these 2 kids in this study, and this outcome seemed to be very influential on their behavior. One of the questions that I often get is, okay, but is this going to work for the entire county school district, or is this going to work for all of these other kids? So what I'm pointing to is this challenge associated with generality, or what some people would refer to as the external validity of some of our findings. So one of the benefits of working in single case experimental designs is that we get this really nice demonstration on a with a relatively small number of individuals, but the reproducibility of the findings is always or frequently presented as a question. So from my perspective, when we think about these submissions to Java and the category of replication, the challenge for anybody who might be considering submitting is that not all researchers agree on what is enough to call this a replication. So I've done the study. I added just a little bit to the procedures. I extended it just a little bit. There's always a question of whether or not you've extended the relevant literature enough. The second consideration when it comes to replications is when is enough in the literature? So as an example, when we think of the link between a functional behavioral assessment and an intervention, we have lots of those demonstrations in our literature now. So if you're going to conduct a replication of that, you need to demonstrate why it represents a sufficient addition to what we already know in the literature. And I think what's really nice about this particular contribution is that it meets both of those criteria. One, there isn't a great deal of single case experimental design research on this topic, so the threshold for enough is enough hasn't been met. And 2, this group of researchers replicated existing procedures and then extended those procedures in an important way by combining some of those independent variable manipulations. So for those who might be considering submitting a replication, the first question to ask is there enough of this particular topic in the literature already? And if so, it probably will not be met favorably by a panel of reviewers. And the second is, what novel additions have I made to this body of knowledge such that the publication of this work is going to bring us farther along our continuum of understanding as it relates to this particular topic? So in sum, I think that the role of replications is critically important for Java and for applied behavior analysts, because in part we use these single case experimental design methods, and the external validity or the generality of our findings comes by way of these replications. So we need those in order to substantiate the conclusions that we draw in any one particular study.
All right. That was very well put, and very compelling argument. So thanks, John. And thanks everyone here for joining me today. And congratulations on the publication of just what is a really cool study. And I encourage everyone to go to the latest of JABA and check it out.
Thank you for listening to the Behavioral Observation Podcast with Matt Sikoria. You can find Matt's notes on this episode at www.behavioralobservations.com. We also invite you to stay connected with us on Facebook at facebook.com/behavioral observations and on Twitter at Behavior Podcast.